If you've ever been given a prescription and once you read it, all you just see is gibberish, like you cannot even understand what is written on your prescription, there's no problem, because most prescriptions are written in medical abbreviations and medical terminologies. In today's video, I'm going to be explaining simple and common medical terminologies that you can come across in prescriptions and how to translate them. Hello everybody and welcome back to the channel. If you're here for the first time, hi, my name is Busabi Moliayo and I'm a registered nurse. On this channel I film content related to nursing and healthcare, and in today's video I am going to be explaining some common medical terminologies that you will come across in your prescription. If you're new here, please click on the subscribe button to join the YouTube family and also on the bell icon so you don't miss out when I drop another video. With that being said, let's get into the video, right? Alright, so one thing about prescriptions is that they have different components. Some part of the prescription is going to tell you the type or the formation of the drug. Some part of the prescription is going to tell you how or when the drug is to be administered, while some other parts of this prescription is also going to tell you the duration for which the drug is to be administered. So let's start from the formation. Some common things you would see are TAB, T-A-B, which is actually an acronym for tablet. When you see TAB, it means that the drug you are going to take is a tablet drug. Next you can see is CAP, C-A-P, CAP, which is actually an acronym for capsule. Other things you can see are IM, which is an acronym for intramuscular, which means the drug is to be injected into the muscle, which could be either the deltoid muscle, the gluteal muscle, the femoral muscle, depending on the condition of the patient. Another thing you could see is IV, which means intravenous, which means the drug is going to be inserted directly or injected directly into the vein of the patient. Now, the example of these drugs are your drip or your free drugs basically. You can also have acronyms like INF, which means that particular drug is an infusion. You can also have acronyms like PR, which means parectum, meaning you're going to be inserting the drug into the anus of the patient. You can also have an acronym such as PV, which means paravagina, which meaning that you're going to be passing the drug through the patient's vagina. So those are common, very common ones. There are a lot of things you see, but those are very common ones you come across. The next thing is how often the drug is going to be administered. So you're going to be seeing simple terms like BD, which is an acronym for the drug to be given twice daily. Usually these drugs are given once in probably one in the morning, one at night, morning and night rather. And there are some other drugs you will see something like TDS, which is an acronym for 3 times daily. So the person is supposed to take that particular dosage 3 times daily. And you can see things like QDS, which actually represents 4 times daily. You can see another acronym like STAT, STAT, which means you give the drug immediately. You can see drugs like PRN, which means you give the drug when it is required. You can see things like NOCTE, NOCTE, which means you give the drug at bedtime. Now the third part that I mentioned are the duration that the medication is going to last. You know, there's a difference between the frequency of the duration of the dosage rather daily and the duration. So when you see things like 1/7, it means a single day. When you see things like 1/52, that's like 1 month. Do you get? So over 7 is usually to indicate days, while over 52 is usually to indicate weeks. However, there can be other variations which are also very simple to understand, but these are the common ones. So I hope you guys now understand how to read your prescriptions. If you enjoyed this video, please give it a thumbs up, tap on the subscribe button below to see more videos like this, and I'll see you in my next video. Bye.